everybody, and welcome to the Outlive Youth Suicide Prevention webinar series. My name is Arjun Kapoor. I work as a research fellow at the Center for Mental Health Law and Policy, Indian Law Society in Pune. Just to give you a very quick introduction to Outlive, Outlive is a 4-year youth suicide prevention program, which will address urban youth suicides between the ages of 18 to 24 in the cities of Delhi, Mumbai, and Pune. Outlive is basically going to engage with young people in this age group through 3 different interventions. The first is to co-design with young people a public engagement campaign on youth suicide prevention to address the stigma and collective silence around youth suicides. The second intervention will look at developing a peer support network wherein young people will be trained as peer counselors to provide suicide prevention support to youth who are in distress. And the third intervention will also train about 10 young people as youth advocates to engage with policymakers for systemic change on youth suicide prevention. The Outlive webinar series is a 4-part monthly webinar, which is jointly hosted by the Center for Mental Health Law and Policy and Sangath. This series aims to provide young people, the mental health community, policymakers, and other stakeholders with various perspectives and lived experiences on preventing suicide amongst young people. Over the course of this webinar and the next one, we will bring into discussion suicide prevention and youth mental health experts on how we can prevent youth suicides, specifically by addressing social and structural factors that disproportionately impact young people in India and specifically in urban cities. So this webinar is specifically going to address the theme of crisis support platforms for mental health and suicide prevention in India. Just before we begin the webinar and I go on to introduce our lovely panel for today, I just wanted to say that we will be discussing issues around suicide, which might be triggering or distressing for some of you. So please feel free to take a break if things are getting difficult. We have also shared details and numbers of mental health helplines and suicide prevention helplines in the description box. So please feel free to reach out in case you feel that you need emotional support. We have a lovely panel, a stellar panel, and I'm absolutely honored to be in conversation with our speakers today. The first speaker for today is Sachi Mulki of Sisters Living Works. Sachi is the training manager at Sisters Living Works. Sachi is a psychologist by training and has completed her MSc in clinical psychology from the Manipal Academy of Higher Education. At Sisters Living Works, Sachi facilitates suicide prevention workshops that aim to raise awareness and equip participants to serve as first responders to any person who is in crisis. Sachi also facilitates support groups which are conducted by Sisters Living Works for mental health and survivors of suicide loss, or individuals who have experienced or bereaved because they have lost a loved one due to suicide. Our second speaker is Savitha Sriram of SNEHA Suicide Prevention Helpline. Savitha is the Joint Secretary and a long-term volunteer with SNEHA, which is basically a crisis support helpline based out of Chennai. Savitha has been associated with the SCARF Cities Rise youth mental health program, which was implemented in city schools for a year. And last but not the least, our third speaker, panelist for today is Tharun E Sai of Find Hope. Tharun is a 21-year-old suicide survivor building a mental health startup called Find Hope, which aims to reduce the treatment gap in youth dealing with mental health issues. Find Hope connects youth with trained peer counselors for free, virtual, and continuous mental health support. Find Hope was launched in May 2020, and the platform has helped over 3,000 youth with an average of 3 sessions or 3 hours spent on single users who have reported an improvement in their mental well-being. So thank you very much to all 3 of you for taking the time and agreeing to be a part of this panel. Really looking forward to being in conversation with all 3 of you and really learn from your work and your experiences and your insights. So the theme today is, as I mentioned, crisis support platforms for mental health and suicide prevention in India. Now, India has one of the highest number of suicides in the world. Suicide is the leading cause of death between the ages of 15 to 29 years of age, and it's the first ranking cause of death, especially for cis women. We also live in a country where mental health support services and facilities are in a huge deficit, huge shortage. There is a huge care gap currently in India. We have a large number of people who are in need of mental health support, but very little access to support and services, also specifically for suicide prevention. There are a few crisis support avenues in India, but obviously not adequate or sufficient for the, a country of India's size. There are different crisis helplines which provide different service modalities and are available at varying times in India. But not many services necessarily cater to the unique challenges that young people experience, specifically young people who might be experiencing distress due to difficult life situations, discrimination, or mental health problems. And hence we thought that this is an important theme to discuss for us to understand in terms of how can we make crisis support platforms more accessible for young people? What are the different kinds of services that young people would need or would require? And how do we kind of jointly develop an ecosystem of support and care to help prevent youth suicide? So I'm going to begin with our first speaker for today. And Savitha, if I can begin with you. A lot of young people who are in distress in India don't necessarily know where to seek support or whom to reach out to in times of need. We also live in a society where mental health and suicide prevention are extremely tabooed. There is a lot of collective silence around it. And hence there is not just an apprehension in reaching out for support, but there's also this apprehension in providing support to people. Or just a basic lack of literacy around how do you provide support to somebody who is in a crisis. Can you tell us a little bit about how SNEHA, the helpline, provides suicide prevention support to young people? And also what can a young person expect when they call a suicide prevention support helpline like SNEHA?
Right. Thank you, Arjun. Yeah, you're right that it's very difficult for a person in crisis to be able to, muster up the energy to go up and take help. And young people, anyway, we all know that the help-seeking behavior is very low by nature. And the impulsive behavior is also very high. And that's a very potent combination for suicidal behavior, right? So it's a constant challenge. Let's be honest about this. It's very difficult. We've been doing this for 35 years now out of Chennai. We basically at SNEHA, we have a crisis helpline. And we reach out not necessarily just to young people. Many years back, before the social media took over and telephone lines became part of your everyday life, we used to have 24/7 support for youngsters at the time of the examination results. India being the kind of country where the kind of pressure on academics is, we used to have a 24/7 crisis helpline just when the CBSE exam results were out across the country and the state results were out, okay? Just to be able to be there to support the young. Those were the times when we had to do it specifically at specific hours. Now, it's like we're open all the time for everybody. It's a constant challenge because you were mentioning about your program being for urban youth. Urban youth, yeah, all of them go through disaster, all of them go through issues, but the rural youth and the youth that are, more challenged, both economically, socially, are the ones who actually have a lot of issues. If in Tamil Nadu, we have a lot of areas, we have a lot of hamlets, and then we go there, and then it's quite overwhelming to see the kind of support that is needed, especially by the youngsters. And all the suicides happen between the ages of 18 to 24 in all these areas. And it's a huge loss. What we do from SNEHA to try and make sure that the helpline number is visible is we try and go through agencies like, for example, the railways. We have all these suicide hotspots across the railway lines where not necessarily people die by suicide, but also the level crossers are not working properly. And then a lot of level crossing areas called hotspots of death. We put up huge signboards where we give the numbers. Visibility of the phone number is one thing that is a constant challenge that we keep doing. We go to schools, colleges, tell people it's okay to not be okay. This is something I think the child needs to listen to again and again and again, and it's never enough. And to be able to tell them that it's all right for you to feel anyway, whatever situation you're in, whatever life choices you have made, whatever you're going through, it's okay for you to talk. It's really what SNEHA simply does. Just ordinary listening. That's really what we've been doing for 35 years, nothing much. But many people often actually forget the power of listening, the power of just being there, of just being there unconditionally, giving this young person a platform, a safe platform to be able to ventilate. The anonymity and the confidentiality. We go to places like IIT, a lot of colleges, everywhere, where they have a lot of peer support groups, where they have mentoring. One of the challenges that we see why people don't reach out is the lack of anonymity and the lack of confidentiality that the young person gets. I believe out of sheer experience that unless these two are provided for the young person, it's very difficult for them to be able to ventilate. And you have to be able to tell them it's okay to feel the way they are, whether it is their gender crisis, or whether it's their financial crisis, or the fear of failure, or facing constant rejection. I mean, God, we can go on. Lakshmi founder, Dr. Lakshmi Vijaykumar, she's one of the leading suicidologists in the world. Lakshmi always says one thing, she says, it requires a load of things to go wrong at the same time for a person to feel suicidal. And that's true for any individual. And imagine the emotional impact of something like that on a young kid. And therefore the cascading effect of the emotion is very high. So all we do is we do this. I like to say that we are just somebody who's like, somebody who just switches off the spin button on a washing machine. Most people who call a suicide hotline is like a washing machine with all sorts of stuff going all over the place. All we do when you listen, any of us, and don't need a SNEHA to do this, honestly, it just needs one caring ear. All you do is switch off, and all the clothes just pile down on one after the other. And all you do by the process of active listening and empathetic, caring listening is simply take out each cloth, show that emotion to this person and say, okay, this is there. All right, you hate this person. All right, you feel this way. All right, this is what it is. And there, it is there for all of us to see what you have. And that's enough for them to make the choice. And most times the choice is how to move on. And it most often than not never fails. Yeah.
Thanks.
Did I answer all your questions?
Yes, absolutely. And I think you made some very important points. What struck out to me is your point about just the power of listening.
Yeah.
It's something that we take for granted.
Yes.
Without often realizing that how powerful that act can be, for any young person. And I think it also points to, because you mentioned that there are so many things which have to go wrong at a particular point in time for a young person to feel something as drastic, as difficult or challenging as the thought of suicide. It also, makes me wonder that, suicide is also a systemic failure. We often put the blame on the individual, but it's actually a systemic failure. And what does that say about a society or a system where we don't even know how to listen to others, right? That we need to inculcate that skill.
It's hard to, in all fairness, it's hard, because sometimes it's a very complex, suicide is a very complex thing. And it's not, while we talked about the individual right now, it's also difficult for the other people involved, because don't forget that every suicide leaves about 6 to 8 people permanently affected. So it is very difficult, and it, like many other mental health issues, this also is a biopsychosocial model. There are different factors, and it's kind of hard to put the blame on the society or this or that. It's just there. It's just there, and then we just need to move on to see what each one of us can do in our own little way to try and support each other. I mean, I would just put it that way, because it's hard for the people involved also, along with the person who's feeling suicidal, because everybody has their baggage. Everybody has their own baggage in the story,
Yeah. And I'd like to come to that point subsequently, Savitha. So do hold that thought about the challenges that somebody who's providing support, what are the kind of challenges that they would experience? Because like you rightfully mentioned, that's a very important aspect. Tharun, if I could come to you now, can you first of all share a little bit about your own journey of receiving support, or also reaching out for support in times when you felt low, you were distressed, or had mental health problems? How easy or challenging was it for you to reach out or ask for support? How easy was it for people to provide you the support that you needed at that time? And where did you find this support?
Yeah, thank you so much, Arjun. And I think the point that I'm going to say is pretty similar to what Savitha ma'am already told. As a student who's studying for IIT, just like a lot of us, IIT is everything for us. And if we don't cross IIT, it's a big loss for us in the life, right? That was the main point, which I guess prompted me to commit suicide. Now, the point is similar to what you told, that a system fails you. I can't reach out to my peers because they're also going through the same problem, right? All of us are preparing for IIT, and I'm sure they have their own problems. So when I got into, when I cracked my JEE mains, I had a lot of health issues. So I was bedridden for about 5-6 months. So during that time, when I reached out to my peers, they were also preparing for IIT, and the first thing that they could tell me was, it's okay, take your rest, you can come back to us later. But the point is, they don't listen, just like ma'am told, right? Because though their heart is in the right place, they want me to get back already, but they don't have the patience and the energy to listen. And I think it's pretty hard, right? Because you're also going through something and you don't want to listen to other person. So what happened was, once the health issues came in at a very young age, when the doctors saw that it's very hard for me to play again because of my back and all, so it's quite distressing for me. And then after I cracked my mains, I got a chance to go abroad for University of Melbourne. But then there was some financial issues and I could not go there. So I was seeing the way opportunities were going out of my hand. I think that is what prompted me in the very first place. And coming to the system as a whole, even at NIT Agartala, which is where I landed up after all of this, I realized that in the very first year, I could see 2 to 3 people commit suicide, not from my year, but from my seniors. And the point is, you see the same person early in the morning during the breakfast time at the mess. They are very happy, and the night you hear the fact that they are no more. I think the point is, they tried their level best, just like me, to not show the sadness to everyone, but they of course reached out to people, and I guess people also tried their level best to help, but the level of patience you need to hear the person's distress is pretty high, and I don't think it's everyone's job, right? So I guess it's both it's an individual perspective also, because I'm not the only person who wrote JEE. Lakhs and lakhs of people wrote, but I was the only one who got prompted into suicide. So I think it's both my resilience as well as the system's support, right? So what I realized is when I went to NIT Gatala, I realized that this is not my competency, but this is my mental health. Until then, I was, because of lack of awareness, I was thinking that maybe my concepts are not good, or maybe my luck is just bad, or something like that, right? It's not very obvious for us that we are stressed, at least at a young age when mental health awareness is not so much. When I went to NIT Agartala, the place Agartala itself is not very well developed. So we didn't have any psychologists in our proximity. The only option was using internet. But the point is, I didn't consider myself that, although I am trying to commit suicide, I didn't want to reach out to a suicide helpline because I didn't want the tag on myself itself, right? There's a lot of stigma, so I didn't reach out to. But what I did was reach out to a psychologist, because it's a bit less stigmatized, like going to a psychologist than going to a suicide helpline. But then what I realized is, out of the 5,000 rupees of pocket money that I was getting, I was paying 1,000 rupees to the psychologist for 1 hour, which is of course not sustainable, right? Because how am I going to maintain my food and everything else? And as a youth, you would want to go to movies and buy those clothes and all. So it's pretty hard for me to manage the finances. So eventually I stopped going to a psychologist after a couple of sessions. So that is what my whole problem and the support journey was. Although I did try and take professional help, it didn't last for long, because if I had to finance it, I'll have to tell my parents, which I think is not a good option because it's just odd, right? Telling to your parents that I'll have to go to a psychologist, and I could not have the guts to tell. So eventually I stopped it. This is what my whole journey of problem as well as support has been. And I think that is where I started getting ideas on how to build Findo, because I realized that it is not just my problem. At least a couple of people in my own campus are dealing with the same. So a solution to it is necessary, and then that is where I started working on Findo. And yeah, I hope a lot of my age kids, let's say, who've been studying a lot for their IIT and NITs, relate to us. May not commit to suicide, but they have felt a lot of hopelessness once they couldn't crack IIT, because it's 2 years of tremendous hard work, 10 to 15 hours a day for 2 years. At an age of 20, it's a lot of work, and I guess the burden of failure is too much for us to handle it at that young age. Yeah. That's it.
Sure. Thanks, Tharun. Thanks really for sharing your own personal journey and story about this. And I think you also raised some important points, especially around the whole issue around accessibility. I think that's a huge concern, especially for young people who might not have access to financial resources, to access support. And in the absence of those formalized mechanisms of care, what are the other informal mechanisms of support that one can rely on? I think that's something which is crucial for us to think about. And I'll come back to you on that point, specifically in the context of what you've been able to do with, which is quite an amazing platform. And Sachi, if I could come to you now. Tharun, of course, spoke about his own individual journey of experiencing distress and even sort of having thoughts of suicide and reaching out for support. Another risk group that is often probably not spoken about as much in our discourse or conversations are people who have experienced loss due to suicide, or who've been bereaved because they've lost a loved one due to suicide. And Sisters Living works with such individuals and groups. My question is, why is it important to engage with individuals who have lost somebody due to suicide from a suicide prevention perspective? And how does your work at Sisters Living Work support their specific needs?
Thank you for that question, Arjun. So just to give you a brief introduction into the organization's inception. So Sisters Living Works was founded back in 2015 by Mrs. Gayatri Datta. And she started this organization after she lost her loved ones to suicide. And with the pain and grief that she experienced, she realized that we needed to have an organization that would work towards suicide prevention in India. And that's essentially what we do as an organization, which which is suicide prevention, awareness, education, raising community involvement, and advocacy. And support groups form a very important part of our work as an organization. So research and studies have also shown that individuals who've lost a loved one to suicide are more vulnerable to suicidal ideation. So it becomes very important to engage with them in a way that supports their needs. So it's really important to also understand the kind of grief someone might be experiencing after losing a loved one to suicide. So apart from sadness, there are feelings of anger, there is guilt. There's a lot of self-blame that comes into the picture. A lot of individuals who've lost a loved one to suicide are more likely to attach a sense of personal responsibility to the loss. So a lot of self-blame comes in here. Then again, a more specific example is when we talk about parents who've lost a child to suicide, for example. Now, there is this universal assumption that, parents are responsible for a child's action. So even assumptions like these can make it very difficult for parents, who are coping with the loss of their child. Then again, when we talk about stigma associated with suicides, because of so much of stigmatization, feelings of embarrassment and shame can also come into the picture, right? As a result of which, people who've been bereaved by suicide can find it really hard to, openly admit that they have lost their loved one to suicide, or, talk about their grief, talk about their loss. People might be uncomfortable in terms of bringing up the topic. So this leaves them with very few opportunities to, openly talk or share about their grief and loss. And a lack of communication can be detrimental in terms of, the healing process or, processing through the grief, which is why a support group comes into the picture. So this is a non-judgmental, safe space for survivors of loss where they can come in, they can share their stories of grief, they can share their thoughts, they can process these difficult emotions and feelings they're dealing with. Engaging with other survivors of loss also kind of instills a feeling that you're not alone, that someone has also experienced a very similar loss. It allows them to engage with them in a way that, lets them see newer ways to, approach a situation, approach a particular emotion that they're experiencing. So at a time when they may not be able to, openly discuss and share this with people outside, in a support group, they're able to more freely engage and talk about their loss, and find a sense of hope and understanding with one another. Another important point that I missed out in terms of the grief is that a lot of people who have been bereaved by suicide also spend a lot of time in terms of trying to question the motives, the why did they, take a step like this? And that can be very difficult to, come to terms with. So again, coming into a space where you are more likely to openly share, learn from one another, see how someone else might be approaching a similar situation, helps you find a sense of belonging, and really impart hope and support to each other.
Thanks, Sachi, for putting that really beautifully. I think what struck out for me was, of course, on the one hand, the kind of grief that an individual experiences, but also then not being able to speak about it, or experiencing the kind of shame or the guilt or the personal sense of responsibility, which can be extremely debilitating. And as Savitha had mentioned, there are so many factors that could potentially go wrong for a person to have to reach to that point, that it's also unfair that a family member has to take that, the entire blame upon themselves. So thank you for really bringing some very important points, which I feel don't talk about enough, and I think it's important to bring forth these various aspects around loss due to suicide. Savitha, if I could come back to you now and taking forward your point about listening itself being an extremely complex act, right? And something that requires a fair bit of training, and a fair bit of self-work as well to be able to sort of reach out to someone and provide the support when you yourself are a vulnerable human being, right? You also have your vulnerabilities. The interesting thing about SNEHA and a lot of other helplines is that it is a volunteer-run helpline, which means we're talking about laypersons who might be gatekeepers or don't have any specific training or background in psychology or mental health or suicide prevention, and they are actually the persons who are running the helpline and providing the support. Can you elaborate a little bit more on what are the challenges that volunteers at, say, SNEHA would experience in providing support, and how does SNEHA prepare and train them to do this task while also taking care of themselves?
Thanks, Arjun. Yes, I think it's a very valid point, because part of the message that we constantly pass on in the community is every one of us can engage in the prevention of suicide. And therefore, that is what we try to say. Yes, we make sure, in fact, that many of us, in fact, one of SNEHA's original advertisements for asking for volunteers used to be, are you ordinary enough to be a volunteer? Because that's really what it requires, the ordinariness of the human being, to just be yourself, to be a listener. We don't need to have any mental health background. You don't need a great amount of listening. Yes, you do need training, but you need to be a very moderate human being to be able to listen to somebody in pain, because it's not about you, it's about them. And how simple you are actually makes you a very powerful listener. And so the challenges of the volunteer, to answer your first question, yes, we are people, and every day in and out, some of the things we tell fresh volunteers when they come in is, there is no feel good feeling when you're in SNEHA. It's not like writing for the blind or pushing the kids on a wheelchair. You don't go away with a sense of, a sense of saying, I've done something, because you are with the depth of despair of so many people. You see the darkness of the soul. So it's a very challenging thing to be able to do this day in and day out. And the challenges for the volunteer themselves emotionally is this, the sense of inadequacy that one can feel in the sheer pain of the other person and not being able to do anything about it, because there is a certain limitation. When you listen to a person, you don't do more than that. But what SNEHA really does, as I told you first, is we are there to make sure that we are there with them while they go through their pain. They go through their ventilation, be with them, encourage them to come out with all the feelings that come out, including their suicide plans, their means, how lethal it is at this point. And we are with them until the suicidal intent has come down to a kind of a safe zone. And we are still in touch with them until we have established contact enough for them to be safe. So it's a lot of work. It's a lot of work. And sometimes, because suicide is a very individual decision, sometimes it's just not enough. Otherwise, we wouldn't be having so many suicides, right? If every person who benefited from another human being stopped, but it's not so easy, obviously, because there are so many other factors involved, and you're not there with them all the time. So the sheer sense of inadequacy, the helplessness that a volunteer could feel, what happened to this person? Because we respect anonymity, we respect their confidentiality, we respect their life, their right to live, and otherwise as well. Unless you tell them that you respect them wholly, and if you don't unconditionally respect them, then they're not going to come back to you. And that's the difference between a crisis helpline and others. So we need to keep those barriers around, and there are a lot of barriers that we work around with. So burnout, volunteer burnout, is a very high possibility. We do have support systems within the organization, and how we prepare the volunteers. So we have a very, very, very rigid, that's the only word I have for it, because many people have complained to me about this. We have a very rigid system of selection and training. On an average, we do this once a year, and this is also voluntary. So we all do other things with our lives, but then we also do this, right? So which means you bring in people, we take each potential volunteer through 3 months of several rounds of interviews, and a very detailed 5-day intense training before one becomes a volunteer. And that at every point, they have the right to say, hey, you know what, this is not what I signed up for. This is too intense for me. Or we have the ability to tell them, look, I think you're going to be disappointed, or you might just break. So we do this constant assessment, before one becomes a volunteer. So one doesn't just sign up an application and end up being a volunteer. We have a 5-day training. So to just give you a ballpark figure of how well trained the average volunteer in SNEHA is, let's say we get about 300 applications or 350 applications. Okay, we go through all of them. By the way, the team, this is a small team, a bunch of volunteers who do the same thing. And by the time we end up with a training program of 5 days, we are lucky if we get an average of 10. Our highest volume of trainees in 35 years has been 17. Okay, yeah. So that's really how it works. Not because these people are not empathetic. It's not because the other people are not, because we feel that many of them may not be able to take it. So it is very intense. And in spite of that, things happen, which is probably why crisis hotlines like us. I remember, Arjun, when you started off in the beginning, you were talking about the limitations of crisis helplines and about us not being available. I remember that, and you have a valid point. We do feel that we are not available as much as we would like to. But then this is it, the number of people and the people who are committed and the people who are able to do it, then they have their own lives. And then sometimes, all sorts of things happen, then you have to move on. So that's pretty much it. But then it's a fine, thin line, but we still walk it. We still walk it, and we are happy to be here, to be there for somebody who needs us.
Sure. Thanks for that, Savitha. It's quite interesting to know that, actually, because often we don't know what goes behind the scenes in terms of the amount of effort, the amount of emotional labor that goes into just training oneself or training somebody else as a suicide prevention support person. And you said something very interesting about how ordinary enough are you to be a volunteer. I think that's a really powerful line, and I do think that listening in many ways is a revolutionary act. So, I mean, how ordinary enough are you to be able to do something as radical as being a good listener, right? But can you just say a little bit about, in terms of the amount of, say, time that a volunteer puts in at SNEHA to ensure that there is a balance between what they're doing at the helpline and their own sort of personal lives and their own mental health?
Right. So on an average, each volunteer, volunteers at the crisis helpline actively for a minimum of 4 hours a week. That's the minimal requirement. And then everything else is extra, the awareness and the training and everything else is extra. We never say that when you come in, okay? That's what most volunteers joke, that you never told us. But then it just draws you in, but the actual crisis helpline work is a minimal 4 hours. And we make sure that volunteers don't do, even when we are going through a crisis. For example, the pandemic was a crisis for all volunteer organizations, for all of us NGOs in different ways. And we work out of the crisis center. So in fact, the pandemic was a huge challenge because many volunteers do not have the privacy to work out of home. Even if to take a telephone call for 4 hours at home and to be able to assist somebody and support somebody who could be actually going through an attempt at that time, and who just called you because they just want one human to be with them during that attempt, it takes a lot. So the crisis, the center itself is well equipped, and we have the backup and everything, but the pandemic threw us all up, right? So we had a lot of challenges on how we are going to support the people, how we are going to support each of ourselves, okay? So those kind of things come up, in which case many people are not able to volunteer. And then some people have to pitch in more. But we make sure that nobody volunteers for more than 12 hours a week, ever, under any circumstances. And we make sure that if the volunteer is this constant, so this being in touch with each other and gauging our own mental health, is a constant process that we do all the time. We tell people to be responsible enough that if you are not okay really at home or anything, it's all right to take a break. Take a break, take some time off, come back. Sometimes, when you're in a crisis helpline, you've been there long enough, you've seen losses, right? You've seen losses and you've heard of losses, and somebody says that this person's no more. So it's a lot. It's no different, Sachi, than a survivor. We are survivors too, in a way. So it's painful. And so then there is a lot of support and there's a lot of networking. And then we try and make sure that this person is supported. And at the crisis helpline also, if a volunteer has taken a call in which there is an active crisis going on, we have a system that supports the volunteer to take the call on, to lead it to its logical end, whichever way it is. Yeah, that's really good.
Thanks for that, Savitha. Tharun, if I can come to you, can you tell us a little bit about Find Hope? And what I found interesting about Find Hope is that it's a youth-led platform, and it's based on a sort of peer support model, which is also very important, because I think when we're looking at suicide prevention strategically, we need to build an ecosystem of support services, because no single one can do the entire job, right? So can you tell us a little bit about how does Find Hope work? What can a young person who is distressed, who's experiencing suicidal thoughts, expect when they reach out to a peer counselor on the platform? And also maybe if you can tell us a little bit about how the peer counselors themselves are prepared for this.
Yeah, sure, Arjun. So I'll first start with an overview of why Find Hope is necessary when we have some amazing organizations like SNEHA. The point is, I think just like me, as most of our youth who are dealing with a mild to moderate level of severity, they will never reach out to suicide helplines because they feel like I haven't gone through that severe issue wherein I need a suicide helpline's help. Okay, so I'm sure there are a lot of more people who are dealing with mild to moderate levels of distress than there are people who are dealing with severe issues, right? Who are just triggered to commit a suicide, right? So the point is, our target is making sure that these mild and moderate issues never go to that severe level. Okay, so when I started, suicide is not something I wake up today and tell, okay, this is all bad. I think I have to end this. It's actually years of turmoil that turns out into some trigger, right? So we thought, why wait when person is dealing with so many years of turmoil? Let's stop it at the very start only. So we are an early intervention platform. That's the highest differentiation. So what do you mean by early intervention? I think one of the first concepts that I heard about early intervention is emotional first aid, which is very similar to physical first aid, where you can do it on yourself or on your friends. So when I started Find Hope, it was not a peer support platform, but it was a club. Okay, so I was from NIT Agartala and all of my friends were at different NITs and IITs. So I personally called up people and established youth clubs in every NIT and IIT. So these are functioning clubs, just like we have, arts club, so drama club, and all those clubs in colleges. We kept a mental health club where we educated, students in emotional first aid. So as an engineer, we are very lazy. We don't want to spend for more than 1 hour on anything. So what we did is we took the standard emotional first aid course of 2 hours, broke it into 10 minutes every day, and gave modules on a daily basis. So let's say we recruited 5 to 6 students from one NIT. It's a 2 weeks process where on a daily basis they get modules. They can go through the module and it takes just 10 minutes for them to go through it. So that is how we started the whole concept of Find Hope in that way. Once we trained around 500, 600 people started referring to us. Like they were like, bro, this person whom I know is dealing with it. Can you help him? Or something like that, right? So I personally thought that just by educating people on emotional first aid, where they learn how to recognize whether they're dealing with stress, anxiety, or depression, and small self-help techniques that they can use to stop it when it's in mild stage was sufficient, but it was not, right? So these people are like our advocates. Whenever they see that their friends are posting something like a sad status in their WhatsApp story, they tell us that, see, we know an organization, please go reach out to them. So this is a network of students in every NIT. Slowly it's expanding to other Tier 2 and Tier 3 cities as well. But then once people started messaging us, I started thinking, how can I help them? Because I can't stop my classes and start taking on calls, right? So that is when one of my friend told that their brother or sister was in a college, and peer counseling was a concept in their college. So they were in Christ University, and in Christ University, in the second year of masters, people it's a credit-based course where every master's student has to help youth and in the supervision of professionals. So we thought this is a great concept. It's a win-win situation, right? Psychology students are getting exposure and they're also getting supervision. Youth are getting free support. It's a win-win situation. So we thought, okay, let's make a platform where we bring in all the master students in one place, and then all the youth, we already have the reach, so youth will come in. So this is how it started. And coming to the point of how are they trained? See, as they are master students, 2-3 months down the line, they are qualified enough to be a counseling psychologist in India, right? So they're almost very well qualified. And as Savitha ma'am told, we don't take in everyone. In fact, we charge them. Okay, that is the reason FindHope is a private limited and it's a profitable startup. So the point is, as a 20-year-old, I can't raise funds for what I'm doing because no one's going to believe what I'm doing. I don't have any background in psychology. So I thought whatever I'm going to do is going to be profitable, such that I expanded myself. So what we do is, whenever an MBA student comes in, they pay something like 500-600 per month, so that they'll get the supervision as well as they get the users. So we market and give users to them, right? So this is how FindHope's business model is, and we have around 100 peer counselors as of yet, and then we on an average help around 10 to 15 youth, right? So how is it going to work? You can just go to findhope.in, simply give your name and WhatsApp number, pseudonym of course, if that's what you want to do, and then the reason for why are you reaching out to FindHope. And then I'm going to reach out to them. So we have an automated bot there. The bot takes out the data from the website and messages them on their WhatsApp number, and then it tells that thank you for reaching out to FindHope. Please go to the website again and take a test. So there is a PSU9, GAD7 and PSS7 test there, and then based on the severity levels, the bot is going to intelligently look into the peer counselors and assign one. So it's a complex AI ML thing that we've done on WhatsApp. It took us a lot of effort, and coming from engineering background, I could do it. So I think that is where we are leveraging both psychology and engineering to build a unique platform, right? So what happens is, if the severity level is more than moderate, the bot is automatically going to give them some kind of suicide helplines, or let's say professionals that they can reach out to. Because if there's because I personally felt that in the initial stages we were taking severe cases, but it was not. We thought we were not doing much justice to them. Anyway, we were escalating that after a couple of sessions. So we thought we'll do it in the very first, right? In fact, SNEHA helpline is also one of the helpline there. So we recommend them to go to helpline based on the severity levels. If that's mild or moderate, the bot is intelligently going to ask the peer counselors, whoever is free, because we want to give them immediate support, right? Whoever is free based on, let's say, the language, the preference, the gender, the bot is going to see and then message them personally on their WhatsApp. And so they're going to, so user's WhatsApp number is also given to the peer counselor who is free, and then they take it forward. So how is it going to start? The peer counselor tells that I'm just your friend, just that I'm in a different college. Okay, so predominantly our users are, let's say, in the age of 18 to 22, which is where your bachelor's people are. Right, so they tell, I'm just your friend, feel free to talk to me. Since it's WhatsApp, no one's going to look into your chat, and if you're comfortable with chat, let's go for that. Audio, let's go for that. Video, let's go for that. Whatever you feel is comfortable with you. And since we are youth, we can connect to them on memes, or let's say whatever that is, right? So we have a good level of I'll talk about that a little later, but then the people will tell that, see, I'm just your friend. It's all a non-judgmental. At least we'll try and maintain it as non-judgmental as possible, and we definitely won't tell your parents or, let's say, anyone else. It's all between us, and they make them comfortable, build a rapport on chat, and then take it forward via sessions. So on every weekend, all the peer counselors meet with the supervisors. The supervisors tell them what to do, what not to do in the future, a treatment plan, and that is how it goes. Now the point is, the biggest problem FindHope has faced is behavior activation. So peer counselors, let's say, tell a person please do meditation, it's very important for you. Let's say mindfulness, it's going to work for you. We as youth are reluctant to do something which is mindfulness. Now we want something which is funky, which is more fun and engaging, right? So it's a big problem there. We listen a lot, but unless the person himself changes the negative coping mechanisms into positive ones, there may not be a huge change in the person's life, right? So in order for us to inculcate that into their life, we build some good comic books, which we share it with them, and they can read the comic books and do it. For example, one of the thing is, let's say there's grounding exercise. We made a good poster which has the most famous meme material in it. So people are more they can easily read it and they can relate to that and they can do it, right? So this is how it is. It's a perfectly youth focused platform. And coming to the problems the peer counselors face, I think the biggest problem they face is time, because they are also students. They are not full-time employees, and this time issue is a big problem, because let's say if a person comes to us at 2 o'clock in the midnight, the WhatsApp bot is online, so it will reach out to them. But for them to get support, they'll have to wait till 8 a.m. or 9 a.m. in the morning. That's a long, big time. So I think that is where the biggest problem is, and we are trying to build an emotional intelligent bot itself for that. And we have few other things going on. We were recently funded, so we are using a lot of funds to build some technology around which is scalable. Because even though I'm sure all the MA students in India are with us, we will not be able to help all the youth in India. We'll need a technology-based platform that is scalable and profitable in order for us to survive, right? So we are building a game or a bot that is in progress. That's the future of finding.
Amazing. This is really quite amazing, Tharun, and also very innovative solution strategy to engage young people in colleges who are themselves getting trained as psychologists, to provide support, to provide peer support, which I do understand has work specifically for young people, to be able to speak to someone of your own age group, somebody who comes from your context, your background, who understands you. Sachi, if I could come to you now. So Tharun's sort of initiative is kind of, in a sense, dependent on the use of technology, heavily dependent on the use of technology. Can you talk a little bit about how some of your activities, including your support groups, kind of function? Like what is the sort of method or the approach that Sisters Living Works takes to running support groups? Has this, of course, been affected during the pandemic? We've also seen a proliferation of support groups and listening circles on the internet. So I was wondering if you have any sort of insights on this phenomenon as well, and how you've had to sort of adapt to the needs of people in the current context.
Right. So basically, as I mentioned, support groups are like one of the most important, one of the things that we work with at our organization. So since the inception of Sisters Living Works, we've had a support group for survivors of suicide loss. But in the light of the current pandemic, we have started with 2 other support groups which focus on emotional distress that people might be experiencing. So a lot of times people might not be able to access, mental health professionals, may not have the resources to access, these places, which is why, we kind of offer them a space where they can come, they can share. But we also very clearly put this out that a support group is in no way, a substitute for formal treatment, therapy of any kind. It's just a space, a non-judgmental, safe space for you to come and share, process your emotions and feelings. So generally, we have 3 support groups each month, and we have it on a Tuesday. And 2 of these support groups are for emotional distress, and 1 of it is for survivors of loss. So we generally put out our dates at the beginning of the month, and it's generally on our social media sites. Or if at all you would like to sign up for any of these support groups, you can write into us. I think the details are also mentioned in the chat box. So generally, if someone signs up, we ask them to sign and informed consent, which again implies that this is not a substitute for therapy, and it's not supposed to be considered as a replacement for any kind of, an emergency or anything of that sort. So then we generally have these support groups, which used to first take place at a designated, location outside, but now because of the pandemic, it's online. So of course, when we talk about the downside of moving, to the virtual mode, is that a lot of times because of the pandemic, a lot of people are at home, so privacy becomes an issue in terms of openly talking or sharing about how you're feeling. So that is a huge downside of doing things virtually. But on the other hand, we've also, because we've moved to the virtual mode, we've been able to reach out to people across the country. So initially these support groups used to happen in Mumbai, but now we're able to reach out to people in other cities of India. So that is how this has also helped us in a way to reach out to more people. And especially when we talk about our support groups for emotional distress and mental health, we have a lot of people coming in, signing up for that. When we talk about how these support groups have really helped, so I've been associated with the organization for some time now, but over the years, we've had instances, for example, where we've had for our support group for survivors of loss, we've had instances where, we've had friendships that have been formed between mothers who've lost their child, and, just being, they've met in the support group, they've able to kind of, forge these bonds of friendship where they've, been able to offer hope and support to each other, cope with whatever they're going through. So as an organization, that has been very encouraging for us, knowing that we've been able to hold that space for them. We've been able to create a space wherein, they can come and they can talk about their loss, their grief more freely, and also, find hope and support in, one another.
Sure. Thanks for that, Sachi. That was helpful to know. Savitha, if I could come to you now. Can you, of course, when you're running a crisis support helpline, there are bound to be ethical concerns, right, around just the issue around boundaries, right? So what kind of boundaries does a volunteer have to put in place internally? That's something that you spoke about previously, but also there need to be external boundaries as well, not just to protect the volunteer who's providing support, but also to respect the autonomy and the agency of the person who's calling you, right? And often crisis situations become are very specific in that sense, because you might have an instance where a person is reaching out to you who is at a very high risk, who's extremely distressed, who's possibly attempting, or going to attempt. And in this kind of a situation, how do volunteers respond in the sense of, is it okay to make a disclosure to, say, a third party, to a family member or a friend of the person, or an emergency service, like, maybe an ambulance service, so on and so forth? So what are some of these boundaries that need to be negotiated, and how do volunteers kind of deal with these situations?
So before I answer this question, is it okay for me to just say something to Tharun? Is it all right? Do we have?
Sure, please.
Yeah. Tharun, I just wanted to say that, I remember you were talking about your references for, and you said, so just to tell you that crisis helplines like SNEHA, many of them across the country, like ours, right, that come under the Befrienders India network, not necessarily cater only to people who are feeling highly suicidal or at any imminent risk of taking their own lives. Most times, most of these helplines offer general emotional support, okay? So I just wanted to clarify that to you. So, when you were talking about the levels of crisis and about emotional first aid, the thought that struck me was that you should know that most of these helplines cater to anybody who's going through any sort of emotional crisis, because everybody needs somebody to.
I think that's true. But the word suicide itself is a severe one, right? Suicide helpline itself is a severe one. So as a person, I'm just telling that they will have an idea that, only if I have a severe issue, then maybe I should go to suicide helpline, or else maybe I should.
What I wanted you to break. So just to say that it's not necessary.
Yeah, that's yes.
Just for you to know for the future, since you have the network. I hope that's okay, Arjun.
Yeah, that works.
Quickly clarify. I thought that was relevant to the conversation.
Yeah, yes.
Thank you. So yeah, ethical questions, any crisis helpline, I think, goes through this, where to draw the line, some of the things, even when you talked about the volunteer, some of the challenges a volunteer has, supposing there's a long-term caller, somebody who's forged a bond over the telephone, one doesn't know the other, but you know each other so intimately, right? That it's kind of difficult to step back. But it's very important in a crisis helpline to draw our boundaries. Yes, being an independent helpline rather than an adjunct line, I think has its advantages, if I may use the word loosely worded, that we are not under any legal pressure to report a crime or report somebody who's talking about a crime, because it may or may not be true, right? Or even to report somebody who is feeling suicidal, or reported somebody who's talking about death or who's going to die, anything. So we, as an independent helpline, legally we may not fall under those because it's a gray area. As far as our responsibility is, I believe that as an independent helpline, responsibility is only to the person who calls us. The beneficence is very important. Yes, the benefit, how much is the beneficence to the person who calls us is important, but also the autonomy of the person who calls is most important for us. Because unless the very fact that the person called us while leaving everybody else and called an anonymous person who listened simply shows that this person already is feeling completely isolated, lonely, and feels that there's no one in this world who understands him or her, and is able to actually talk about their suicidal feelings, their plans, their means, to say how I'm going to do it, when I'm going to do it. So it takes a lot for them to be able to do that, which means that it has happened, that the connection or the bond has happened with the person to be able to say this. So while the safety of the person is tantamount, we also respect the autonomy of the person. So what we do is, as long as the person is in control of his or her senses, we need that person's okay for us to be able to call anybody. Okay, we ask them, if they're in the middle of an attempt, we ask them, can we call the ambulance? Do you have a neighbor? Is there anybody outside the room? Could you open the door? We take them through all that. And I've done this for a lot of years, and I can tell you that, remember, this person didn't do it. He or she called us. Because that level of ambivalence, that all the time a person who's suicidal is going through this pendulum, this cat on the wall. Should I live? Should I die? Even at the moment of wanting to attempt, or in the middle of an attempt, there is this small wish to live somewhere that made you call this line. So we hold on to that. In fact, for SNEHA, our emblem is a link to life. That's our emblem. It's the link to life. And that's the power of listening. The ambivalence of this human being is what we cash in on. It has never failed. I never use the word never, but most often than not, it does not fail, because this person called to say, I don't want anything. I'm doing this. I got this in my hand. I'm standing on top. I got this news. I'm going to jump, but I wanted to talk to you first. All right. You wanted to speak to me. All right. And so therefore, we cash in on that ambivalence to make that person say, okay, this is the number. Call my mom. This is the number. Call my spouse. Or they say, all right, I've gotten off the stool. I will make the call. Or I've opened the door. Let me give the phone to my mom or my cousin or somebody who's there, and let them get help. So most often that ambivalence kicks in because there is somebody who cares, who genuinely cares, who's on the other side. And the wish to live kicks in. most often than not, it kicks in against the will to die, And so therefore, to answer your question in 2 lines, no, we don't do anything unless the person gives us permission, as long as they are conscious. If they are not conscious, and if it has happened in the center, right now we are not doing visits, but if it's at the center and somebody has visited us and something has happened, then we wait. If once they are not conscious, then the beneficence kicks in to any degree and we are able to take them. Yeah. So it is a very difficult ethical question, and it's very hard for some people to say, if the person says, I will not do anything, you keep the phone, or he or she keeps the phone on us, the question always remains, could I have done something more? But we believe that this is the only thing that will help them, because they need to rein in that wanting to live has to kick in. And that will sustain them much longer than anything else you and I do, finally.
Thanks, Savitha. That was really informative and powerful as well. The idea of ambivalence, I think it's really got a lot of.
Every suicide prevention agency lives in the hope of that ambivalence kicking in the human being. That's the only thing. That's our lifeline. Nothing else.
And I think it's something which we all can learn from as individuals. We're all. We've got loved ones around us where we're constantly in the process of providing support, receiving support. So I think for us to also know that to just catch on to that ambivalence, is really powerful. So thanks for saying that, Savitha. Sachi, if I can come back to you. I'm going to add a couple of questions. One is, as somebody who has been engaging with people through the medium of support groups, I was wondering if you had anything to say to young people who are trying to build resilience, right? And I think that's important for young people to be able to build resilience, especially to deal with difficult situations in life, which all of us are bound to experience. How can young people build resilience and cope with some of the difficult things that they're going through in life? And my second question is slightly different. It's also about how, because we have been talking about the role of technology, how do we also enable access to those who don't have access to technology, right? And of course, support groups is one very powerful medium, again, where there is a social connectedness which is happening. There is a certain bonding which happens between people. There's a sharing of grief or feelings of emotions. And so there is a holding and containing which happens, right? And what kind of a role can this play from the point of view of suicide prevention, especially for people, groups, communities, young people who might be coming from marginalized spaces, who don't have access to technology, right? Or who don't have access to financial resources to be able to find support.
Thank you for those questions. So, like, to answer the first one in terms of resilience, and especially if I have to just talk in terms of the current situation, the pandemic, and the effect it's had on our mental well-being. So I sometimes feel that resilience can often get misconstrued as just being strong all the time, or not being affected by what's happening around us. We're kind of fed these ideas, a lot of times. And based on my interactions, I've seen a lot of times, even when a lot of young adults were struggling, or were experiencing distress, they were very hesitant to reach out for help. Now, there are a lot of reasons as to why someone might be hesitant to reach out. But one particular reason that I often come across, is that maybe my problem isn't that big. Or, this kind of comparison that maybe, someone else has it worse than me, and they seem to be doing absolutely fine. or someone else is dealing with a similar situation but they're coping fine, and maybe I'm not able to do it. Maybe there's something wrong with me. So somewhere we in the process they end up invalidating their own emotions, their own experience, and it becomes more of maybe it's just me, maybe I'm weak, or maybe it's just a flaw in me. And this is which is why they tend to suppress what they're feeling. They may not be open about sharing this with people. And it's very important to understand that even the same situation can affect two people very differently, because we're not just talking about individual factors, but we're talking about the systemic factors which also come into play. So how something might affect one person can affect the other person very differently. So it's very important to remind yourself that it's okay, as even Savitha mentioned at the beginning, that it's okay to not be okay. It's okay to feel the way you're feeling right now, and to really give yourself that space in terms of reaching out for support and help when you need to. And just because maybe your situation might not seem that big in comparison to someone else, that does not make your emotion or your feelings any less important or invalid in any way. So, this is something which I feel a lot of times I've come across in my interactions with a lot of young adults. To answer your second question in terms of accessibility, and I think that's a huge problem, because in terms of awareness and access are two factors which, are things that we need to really pay attention to in terms of, being aware of even just mental well-being or mental illness, let alone suicide, but even just understanding the importance of your mental health is something which a lot of people are not aware of. And this is something that, as an organization also, that we intend to kind of, really focus on in terms of how we can take this kind of awareness about even suicide prevention into the communities. So say, for example, maybe training one person in a particular community to on what is, suicide, what are some aspects to keep in mind when you're supporting someone who is in a suicide crisis, what are some of the myths related to suicide. So I feel we need more of these interventions, more of these, trainings that we can conduct in a community. Maybe have one person take charge, be responsible, so that, they are able to, that one person, someone else in the community can reach out to, and then maybe they can help them, get help from a professional. So this is something that I feel we need to do on a larger scale, because that is so true in terms of accessibility. A lot of people aren't aware about it, and it can, I think, of course, there is a privilege of technology which some of us have access to, but that leaves out a large number of people from this kind of preventive, education. And right now, because of the pandemic, that again has been affected all the more, because everything has moved online, in terms of even reaching out to people otherwise can be very difficult. So I feel this kind of training, awareness programs is something that we need to take it down to the communities, get people involved in terms of, training one person, so that, they can kind of take charge in that area they live in. So people can reach out to them in case they are in a crisis. So that is something that I feel that we need to collectively, of course, work towards.
Sure. Thanks, Sachi, and I completely agree. Awareness and accessibility, especially in a country like India, where, and of course, as mentioned before, Outlive is a program which is focusing on urban youth suicides, where we're living, and 3 big metropolitan cities of India, where one would assume there exist services and mental health professionals, but 70% of India lives in a rural context where there is no mental health system, to say so, and very little means to access technology as well, apart from the issue around awareness. So I think these are fundamental, foundational questions which we need to think about. So thanks for those interventions of yours. Tharun, if I could come to you, the last question before we move to final remarks. One is, based on your work of not just your own personal journey, but your work of building a peer support platform for young people specifically. Can you talk a little bit about some of the issues that young people are experiencing today, and how can we better how can we develop interventions which are suited for the needs and preferences of young people? right? Especially young people who are experiencing distressing life situations, young people who are experiencing discrimination on the basis of identity or socioeconomic factors. How can we build interventions which are informed to address the needs and the desires of young people, in different contexts?
Thank you so much, Arjun. So, I guess if you talk about today's situation, because of the COVID, at least the group that we are catering to, it's morely focused on exams and jobs, right? Because as you are in your bachelor's, and our university could go for online exams, but a lot of private and state level government universities have been postponing their exams. So people who want to go abroad for their higher study, it's a big problem for them, right? And coming to jobs, I guess. I think coming from an NIT, my idea of how many jobs are in the market is quite limited. But I guess I'm sure that the kind of jobs we are getting right now is pretty different to what our seniors got within just 1 year of span. There's a lot of difference in the job market. So I think people are feeling that will I ever get a job? Because if the next pandemic, if the next wave comes in, people who are in the third year, they will miss 2 years of important subjects, right? In the very first 2 years of bachelor's, at least in engineering, not much of core study is done. So I think the problem is exams and then jobs. Because of the uncertainty, people are anxious whether they'll end up a good job or they'll have good exams, at least have exams in the very first place, right? So that is, I guess, the main problem. And coming to the second problem, how are we going to make it accessible? At least for me, I feel that there is no huge brand. As Indians, when we have cold, we don't go to a doctor first. We go to that drugstore and tell them, please give me a crocin, please give me something like that, right? Because that is what we are used to. I think the whole concept of support, making it accessible, should come through peer support only, because I think we still feel that professionals should only kick in when we have a bit severe issue, right? When we have dealing with mild to moderate issues, it should all mostly be peers. So I think the only concept should be peers, and peers should come with a brand attached, like a reliable brand. Because when you talk about WhatsApp, you know that your chat is private. That is the only reason you're using WhatsApp and not Telegram or something else, right? So I think there should be a good brand where people can trust, because anonymity is very important. So I guess both peer counseling with a good brand is what is going to make it accessible, at least in the digital sense, for urban people. Now, coming to rural people, I have not worked with much of them, and I have no idea of how to really help them. But I guess for the urban people, these two, if we could make it, I'm sure it'll become much more accessible than what it is right now.
Sure. Thanks for that, Tharun. There's a question which came in, and I thought maybe, Tharun, you could address it. When you say system, what are you referring to? Parents, teachers, fellow students, our collective ideas of success. Can you dwell some more on the system?
Okay, sure. So when I talk about system, personally, for me, I feel our parents and students constitute the majority of the system, or at least we give more emphasis on our parents and friends than teachers or the collective idea of what is success in the society, right? Because they are close to us, and of course we listen to them, we give more emphasis on them. So I think if they are more non-judgmental and they are more open to listening than giving out solutions in the first place, or relating to their own personal experiences, I feel that is where the system can improve. And I'm sure that it's different for us. Some of them might believe that the materialistic success is what more important, what their friends or let's say parents think. But at least for me and what I've seen, a lot of people feel that these two components constitute the majority part of the system. So solving these two components will solve the majority problem, at least for me, because as a whole society, as an overall collective of everyone, from industrialists to teachers to administration, it's quite impossible for us to dictate what a coaching institute is going to tell to a student, right? So I feel these two student friends and parents is what the major part of system is.
Thanks, Tharun. Okay, we've got about 10 minutes left. I don't think there are any other questions. I would request the audience, in case you have any questions, please feel free to put it in the chat box. We will address it. But meanwhile, maybe if we could do a round of closing remarks. Savitha, if I can begin with you, would you like to say anything just as closing remarks to young people? And also, if you could very quickly address the question on accessibility from a helpline point of view. Also, in terms of because anonymity is a big factor, but we also know that the risk factors of suicide are multiple, and they're often shaped by socioeconomic issues, cultural issues, identity-based issues, or discrimination. So, in that context, does how does one address the challenge of on the sort of the service side of preparing the helpline volunteers to be able to understand different kinds of issues that people might be experiencing from say the point of view of discrimination or socioeconomic issues, because that also is a question of accessibility as well. So if you could quickly answer that along with your closing remarks.
All right. So to understand your question right, when you said, so the way I look at it in a crisis helpline, accessibility in terms of timings is one thing, right? Accessibility in terms of what we offer is the same, immaterial of what the problem is. Okay, that's really what a crisis helpline prepares a volunteer for. So whatever the issues of the person, okay, whether it's starting from a breakup of my first breakup to multiple issues of my marriage breaking down, of my having financial issues, of my having physical issues, my have mental health issues, ranging from A to Z, whatever the problems are. Like I think Sachi was saying, one needs to first understand that if it's a problem for me, it's a problem. All right? There is no what is big and what is small. There will be zillions of issues. What a crisis helpline really does, or what SNEHA also in particular does, is we go for the feelings of the person. So if I've had my first breakup, I mean, it is the most painful thing, and probably a guy who lost his fourth job may be coping better than me. So to look, whose perspective is important in this? It's the perspective of the person who's in pain. If you are able to simplify that, then support for a person in crisis becomes the same. And that's how, in fact, you can validate the person's pain. One needs first to be validated. I need to be feeling safe to say that no problem is too big or too small for me. If it's a problem for me, some people call and say, I don't even know if I can talk about this, It's okay. If you felt it was a problem. So then this is a platform to talk about it, is what a crisis helpline does. So that would answer the chunk of your question, that immaterial of what the problem is, what is the discriminative issue, whether the person has a gender identity, whether a person has whatever the problem is, it's affecting me emotionally. It's affecting me to the fact that I feel lonely, I feel isolated, I feel nobody understands me. I feel so sad that I had to pick up a phone and call a stranger to speak about the way I feel. How bad can it get than this? And therefore, you are the most important person for me now. And therefore, all that you say is important. And we are here to support you without any judgment, unconditionally, and totally there to listen to you. And I often say this thing, care is not just, it's compassion and confidentiality, accepting the person for who they are and for what they've brought to the table. Respect them for who they are and for the choices that they've made. And when you wrap all this up, you will be able to empathetically listen, and that never fails, believe me. We may not help them through their life. We will never be able to help them through what they're doing, but we will definitely help them to go through this crisis and be able to find their own platforms to cope. Coping mechanism comes from within. It doesn't not always come from the outside. Most times the outside simply supports you while you find the coping mechanism that is best for you. I may be able to give you a list of advice of do this, do this, do this, do that, but I need to find reason to do that. And that will come only when I am able to be okay with who I am. And that's really what a crisis helpline does. Yeah.
Sure. Thank you.
Yeah.
And you were saying something more?
Yeah, I just want to say one more very small thing in terms of accessibility and awareness that all of you were talking about, which had great merit in suicide prevention. But I also, wanted to add and say that destigmatization of the word suicide is so important. Even when we are all talking here, in suicide prevention, suicide seems to be a big word. Suicide seems to be a big word to be used only in a crisis. Remember, anyone can feel suicidal, right? And to feel suicidal is not a bad thing. It's just a painful thing. Where we need to destigmatize suicide through our awareness so that anybody can say that even if I feel, hey, you know what, life is so tough that I just feel I can close my eyes and just go away, is a very initial suicidal feeling. And a person must be, destigmatized enough to say, even if I feel this way, I should be able to go and take help. So the word suicide should not be a dirty word. It should be a word that is synonym with just deep pain. That's my only appeal to all of you youngsters who are doing great work here. Okay.
Thanks, Savitha. I couldn't agree with you more on that last point for sure. Sachi, last words.
Well, I would just like to say, I think, as Savitha again mentioned that, there is absolutely no reason to bring in any kind of comparison. If you're not feeling good, that is what all that matters, and I feel like we do have crisis, helplines which are available. And, at Sisters Living Works, as I mentioned, we have our support groups and they are free of cost. They're open to anyone and everyone. So we do 2 of them for emotional distress. So, and I know these times have been really hard with the pandemic and, the effect it's had on our mental well-being. So if at all you do feel the need to, if you're seeking a space where you can just come, share how you're feeling, we'd be more than happy to have you join, our support groups for emotional distress. And we also have our support group for survivors, of loss. So I just feel that we need to have, of course, more conversations surrounding, mental health, mental illness, and of course, as Savitha very rightly mentioned about, destigmatization of suicide. There's still so much of stigma when, we talk about suicides, which makes it very difficult for people to have more open conversations or even, talk about it. So that is something that we really need to, of course, bring forth in terms of having more conversations, talking about it. So that's all I would like to mention. Thank you so much.
Thanks, Sachi. Just to reaffirm what you and Savitha have said, one of the attendees just sort of sent a message saying it's an excellent point about destigmatizing the word suicide. Young people should feel good about seeking help for their distress instead of feeling ashamed and afraid. That's an excellent point. So thank you for sharing that with us. Tharun, the last word is for you.
Yeah, thank you so much. I guess I learned a lot about the perspective. I think all the 3 of us are from very different backgrounds, and I think our experiences are quite different. And it was quite enriching for me to hear from 2 different backgrounds, and I thoroughly enjoyed it. And I hope all our participants also learned a lot from it. Yeah, and I guess hopefully Outlive brings up with a great peer support platform, which is going to take into consideration that we can use memes, we can use comics, we can use things which relate to youth in order to destigmatize it, right? Which is something that you are already doing. By looking at the website, I can clearly see that it is pretty colorful, it's pretty warm. So I just hope that it really happens. And if you would want to leverage our network of peer counselors, or let's say students across engineering colleges, we would be more than happy to help you use that. And that's it. Thank you so much.
Thank you for that, Tharun, and I'm pretty sure we will be engaging with all of you here on this panel in the months to come, and we look forward to that. On behalf of Sangath, Quicksand, and Center for Mental Health Law and Policy, I'd like to thank all of you for what has been an extremely enriching, extremely rich discussion with some amazing points that all of you have brought up from your own personal experiences. There's a lot that I'm going back, and I hope our attendees have benefited from this as well. So thank you very much once again. Seriously, heartfelt gratitude for coming on this panel and taking the time for it. So thank you very much. Thank you to the attendees for participating and listening in, and we hope to engage with all of you in the coming months. So thank you, and take care, and be well and safe.
Thank you, Arjun.
Thank you so much.
Great work, kids. All the best.
Thank you so much.
Thank you.